International Forum for Promoting Homeopathy was formed during the COVID pandemic, and it was formed by a group of homeopathic lovers, doctors, and students. And we are regularly conducting 3 sessions in a row. Just we completed our Hindi session, and from 8 to 9, we have our English session, and 9 to 10, a local language session in Malayalam. So all in all, 3 sessions going regularly, and we are uploading every videos nowadays on the very next day itself, so that you can watch again and again, and you can subscribe it and without paying a penny, and you can also share with your friends so that homeopathy will be promoted among the public as well as homeopathic doctors and students. So let me come to the today's guest, and as you all know, Dr. Upendra Kumar Verma has completed his DHMS and then took MD in homeopathy. He has an experience with the additional knowledge in German language from Max Muller in New Delhi. He has a professional experience of 32 years and teaching experience of 28 years. At present, he is the vice principal and professor and HOD of the postgraduate department of Organon of Medicine and Principles of Homeopathic Philosophy at GD Memorial Homeopathic Medical College and Hospital, East Nagar, Patna. He is a member of the Board of Studies in Himachal Pradesh University, Shimla, and PG examiner of Maharashtra, UP, Bihar, and UG examiner, Himachal Pradesh, Madhya Pradesh, UP, Bihar, etc. And has presented many scientific papers in different parts of the world, and as one of the best presentation was at Liga in New Delhi on 2nd December 2011. Presented several papers at CCH workshop New Delhi, and presented papers in several scientific seminars conducted ROTP at GDH Medical College and Hospital, East Ramakrishna Nagar, Patna. And doctor is also running a homeopathy clinic by name Homeo Medicare at Patna Toll, Vidyapuri Market, Patna. And so this is a very good session about to begin. We have a very good subject to discuss. One of the commonest problems nowadays, the new generation, ladies, not only ladies, even among girls also, I must say that, because even people getting the menarche itself, there may be problems with the young children and girls also. So we know that polycystic ovarian disease and this homeopathic management is very, very important. And this is a very, very good subject. We have discussed many times here in this forum, but every presentation have its own beauty, its own importance. So let us welcome Professor Upendra Verma sir to this session. You can begin the session, sir. Please unmute yourself, sir. You are a co-host. Yes.
Thank you. And thank you, International Forum, for promoting homeopathy. And thanks once again, because you have given several times opportunity to speak over some or other topics. Thank you, Dr. Dhanesh, and thank you, Dr. M.K. Sani, sir, who has given the link, and that is why I am here today to speak over a topic. So today's my topic is related to the polycystic ovary disease or ovarian disease or polycystic ovary syndrome. So why I had opted this, I perhaps opted this because nowadays I am seeing several cases of PCOD now and then in our clinical practice. Not only myself, but I hope that many of you, the physicians, might have been seeing or examining the patients related to PCOD. So I will discuss a few points over there and why it is there, PCOD, and what should be our approach, how it can be managed homeopathically, and whether we are in a position to cure such diseases or not. That will be discussed today. So let me share the screen. So So this is related to polycystic ovary disease. And what I wanted to show, I know that everybody is knowing this, but then that. So this is a fallopian tube, as we know, and this is the normal ovary. And this ovary is particularly having some small balls-like structure, that is polycystic ovary. This is definitely uterus and vagina, and this is the cervix. So this PCOD is also known as SL syndrome, and it was first described by Stein and Leventhal in 1935. That is why it is known as SL syndrome on their name. Now, this syndrome is commonly known as PCOD or polycystic ovary disease or PCOS, polycystic ovary syndrome. So, this is the disease for which I am going to talk about. And this is another slide which is showing that how it looks like. It is enlarged. Of course, it has been taken from the internet. And this is the structural image of polycystic ovary. So you can say why it is a polycystic. There may be single or multiple. Since there are several cysts are there, so that is why it is known as the polycystic. So what is happening that nowadays it is very common problem among girls and young women in their reproductive age. Why it is happening? Because that may be due to lifestyle, that may be due to food habits, that may be due to several other causes, several stress, several emotional causes. Because exact cause is still unknown. Because modern science says that why PCOD occurs, it is unknown. And since we understand that what happened in these days, I mean to say in the several few years back, that so many cases of PCOD we are seeing off and on in our clinical practice. So let us see that what are the indications of PCOD, how can we identify that the patient who has come to us in our clinic, whether she is suffering from PCOD or not. So there are several indications which are fixed. That is, that patient experience irregular menses, heavy or scanty, or acne vulgaris, I'll say, difficult in getting pregnant, and patch of thick dark velvety skin over the neck or somewhere else, and excess hair on face parts of the body, that is known as hirsutism. There may be, and this velvety skin is known as the acanthosis nigricans, and this hirsutism. These are the unwanted hair, which no female would like to see such types of hairs on their body. And one more thing may be there, that it may lead to obesity also. So these are the indications for PCOD or PCOS. Whenever a patient, female, uh, definitely at the age of reproductive age, comes with these symptoms, sign and symptom, it definitely indicates that it might be PCOD or PCOS. So for PCOS, basically, this is due to disorder of endocrine system in the female reproductive age. As I have already told you, that it is the uh, fault, or it is the uh, trouble in the reproductive age of the female. So what would have happened, what I can expect, that it starts when the internal physiological function gets disturbed, leads to neuroendocrine disturbance, which further affects the ovaries and the adrenal glands, which is situated over the kidney. It starts production of the excess of androgen, which further disturbs the growth of ovarian follicle. So basically, this is a phenomena which is being explained by the modern system of medicine, that whenever the physiological function gets disturbed, neuroendocrine also get disturbed. And due to this neuroendocrine system, when get disturbed, the adrenal glands starts productions of excessive androgen, which further disturbs the growth of ovarian follicles. And this ovarian follicles, if it is there, it may cause several problems. This is another. Now, hence PCOD is a disease related to excessive production of androgen. This is focused over the system, that is the neuroendocrine system, that it is basically due to production of androgen, and it causes the disturbance in follicle formation in the ovary, and the condition of anovulation. When ovary do not ovulate, it starts due to, and it is further leads to amenorrhea, which is observed. So another, once again, I want to refresh you that what we find, that is irregular menses, early or delayed period, or it can be amenorrhea also. And this situation, when a patient suffers from this polycystic ovarian disease, then infertility also causes, and the woman, the lady, have the difficulties in getting pregnant. Obesity is one of the also indication, hirsutism and acanthosis nigricans. So what investigation can confirm? Suppose that a patient has come to our clinic and such symptoms are being shown by the patient, exhibited by the patient. We can do two things. First, we should get USG done, and we can find that the enlarged ovaries are there, exist. And then we also send for the investigation of the blood for female hormones or female hormone assay. In this hormonal assay, what we find that luteinizing hormone is elevated and estrogen is also elevated. Sex hormone binding globulin, SHBG, is reduced and androstenedione is elevated. Testosterone, which is the male hormone, is also elevated. Dehydroquinotestosterone sulfate may be elevated. Raised serum insulin. These are the things which we can find in the blood investigation when give for the serum hormone assay examination. Now, as I told you, that the exact cause is unknown for PCOD. So what we examine and get investigation, that only shows the event of the series of pathological indication in any given time, starting of the disease, after starting of the disease. What I wanted to focus over here, that suppose that I have told that if the symptoms has shown by the patient, we send for the USG, we send blood for investigation for hormonal assay. Then these things is not the real cause of getting any other trouble. So PCOD, it is being shown, it is one of the event of the series. The PCOD, why it has happened? Because we have just come to know that overproduction of androgen, that is adrenal gland production, is over. And why it is over? It is, again, it is unknown, which I have focused that due to some neuroendocrine disturbance it happened. Now, why the neuroendocrine system has started disturbance in neuroendocrine system? So here the cause is unknown, and even Dr. Hahnemann has said at what modern science is searching in any disease, the material cause of any disease. So as I have just shown that polycystic, so this polycystic is the material cause. And another I have told you that elevated LH, luteinizing hormone, is also a material. But this is not the exact cause of the disease that androgen has raised. That is why the polycystic ovarian disease. It is just a point of event of the series. Here we are saying not the exact cause of the disease, but the event of the disease. Rather, I would say, if you see the if we see the polycystic ovary, it is always the product of the disease, not the exact cause of the disease. So PCOS or PCOD can be treated through homeopathically system medicines. But in homeopathy, there is no any specific medicine. Yes, we do not have any specific medicine, like as there is a medicine like glycodin, grelintus for cough. There is a medicine sumo or aspirin, or I can say that paracetamol for fever. It is not like that. That in homeopathy, we have any medicines which can given, or several types of medicine which can be given and said to be, this is the medicine for polycystic disease. So what is the difference between a specific medicine and a specific remedy? A specific medicine is given in the name of the disease. The medicine for diarrhea, it is a specific medicine, and medicine for any other disease like fever, like cough, like cold, it is, if it is given in the name of the disease, it is said to be a specific medicine. But in homeopathy, we do not have any specific medicine, like this is the medicine for your cough, this is medicine for your cold, this is medicine for your abdominal pain. No, we do not have. We have only a specific remedy. And how can we come to the conclusion of a specific remedy? It can be known with the individualization of the patient. When we come to know several symptoms, several indications, several modalities, then we come to know after totality that this medicine is suitable for that particular individual patient, and it is said to be that it is a specific remedy for that particular condition or particular disease. So we cannot say for treatment of PCOD or PCOS in homeopathy, the PCOS or PCOD can be treated and recovered on the basis of the totality of symptoms in individual patient. So how can we treat? It is not only for PCOD or PCOS. Rather, I would like to say that every disease, whatever the patient is suffering from, if they come to our clinic, all such patient needs to be individualized, and after individualization, on the basis of totality of symptoms, such treatment is being given, and that treatment is especially for that particular patient. I wanted to convey you like that if a medicine is selected on the basis of totality of symptoms, then that medicine will be a specific remedy for that particular patient, not for every patient. So PCOD or PCOS can also be treated in the same manner. And we, after individualization of the patient, we can treat and even cure the patient. So this is what I wanted to focus over, and especially again, I would like to talk a few things. Every individual may have individual cause. Now, for PCOD and another disease, basically it is perhaps due to some emotional disturbance, as so far as I think, because nowadays everywhere is a stress, whether it is a school-going children, for their homework. So at the age of 12 and 13, for teenager girls, or for such lady who has been married newly, then in the in-laws house, there may be several problems which would have not been expressed by that particular lady. Several such things also happens in the life of unmarried girls, which is not being expressed by them due to some or other causes. So that emotional stress may cause some disturbance in her. Now, it is not like that every individual will have same types of PCOD or PCOS suffering. No, it is not like that. Every patient has got their individual constitution. And that constitution comes from the parental history. So what the parents, forefather had the diseases, and what they have come according to the codes of his blood or constitution, or I can say the corporeal constitution, accordingly, the triggering factor, the emotion, the causation affect the person, and accordingly, the internal economy plan the disease. that this person, since their parents in the past history, what patient was suffering from, what their parents suffered, accordingly the plan is being taken, which is not, which cannot be explained properly, but it happens that whatever the diseases their forefathers, their parents suffered, and that leads to decide that what part is going to be affected with the stress or some emotional causes. So emotional disturbance which is due to any particular history of any event in the life which may have played some instrumental role in the disturbance of neuroendocrinal system, and that instrumental cause cannot be seen materially with any modern instrument. Yes, as I told you, that such disturbance which I am just explaining, it cannot be seen. Yes, this type of the stress was there because the stress cannot be seen materially. It can be felt, it can be experienced. And every person, whosoever is having same type of stress, suppose 10 persons are having same condition of stress, but every individual will indicate some disease causes or disease thing. If their health disturbed, they will be suffering individually, not in the same manner. So as I understand that causative factor are the same, but the effect of every individual is different because his or her corporeal constitution is different. So this was the focus over the cause of the disease. So if even after understanding that the person, the patient, whosoever suffering from PCOD or PCOS, so there it may be higher androgen, there may be due to some neuroendocrine disturbance, that may be due to some stress. So what other effects have taken place, and that should be taken into the consideration as a totality of symptoms. However, there are few medicines which have been indicated in our repertory also that these medicine can be utilized. But this is not saying, it is not saying, repertory is not saying that these are the medicine which you can give. No, it should be chosen on the basis of the individualization and totality of symptoms. So mind it, whatever I am showing you, it is few indicated homeopathic medicine in the repertory, and one can find it in the female genitalia, sex, tumor in the ovaries, and in ovaries there are cysts. So the medicines are Apis, Argentum metallicum, Aurum neonatronatum, Belladonna, Bovista, Bromium, Ufo, Canthris, Carboenamylis, Carcinosin, Colosynthis, Folliculum, Iodium, Calibicrom, Calibromatum, Lachesis, Lycopodium, Murex, Moxol, Naza, Palladium, Phosphorus, Platina, Podophyllum, Prunus, Rhododendron, Rustux, Psychocus, Syphilinum, puja, etc. So these are the medicines which can be indicated for ovarian cysts. But I cannot say that there may be some other medicines also because we focus over on the totality of symptoms. So these are just a rough idea that these medicines can be indicated for a particular person. Similarly, if a patient is suffering from right side ovarian cyst, then we can think of Apis, Belladonna, Lycopodium, Palladium, Podophyllum, provided that the totality of symptoms matches. If it does not match, it cannot. So if there is some left-sided left-sided ovarian cyst, then we can think of Calibicrom, Lachesis, Naza, Palladium, Phosphorus, Platina, and Thuja. And if the cysts are painful, then we can think of Psychocus also. So these are the roughly indicated medicine in our repertory. It never means that we should pick and choose the medicine from here. But of course, if the patient covers any totality with any of these medicine, it can be given. So this is just rough idea that these are the medicine which are indicated for polycystic ovarian syndrome or disease in homeopathy. Now, I would like to give examples of some cases which I have seen in my clinical practice. So there are 2 or 3 cases I will discuss. One case of Svikirti and one case of Miss Asha, and 2 cases I will in the memory, that old lady of 34 years and a lady of 28 years. So these are the 4 patients whom I would like to discuss here on this forum, that these cases have, it is not like only these cases. There are several other cases also which have been treated and recovered, but these cases are in memory and I have the documents. That is why I am showing. So first, I would like to go through the case of Miss Asha. So Asha case this is the report which you must not be seeing well due to being its small font. So I have cut it in 3 parts. So now you can see that it is the USG of Miss Asha and it is of 6 September 2018. So mind it is a 6 September 2018. And I am showing you because this is it is our clinical case. It is my clinical practice case. So here it is UK Verma is written here. And here you can see the thing about impression. And impression, it is seen. The scan appearance suggests bilateral polycystic ovary. So mind it, just I have shown that the first, which were in September 2018, it shows that there was polycystic ovary syndrome. And again, you see, just after the treatment of 4-5 months, that was of September 18. Now it is 19 January 2019, just after 4 months. So it has also been cut, and you can see the conclusion that here it is written that no hepatomegaly, no bladder, no calculus, and no focal uteri. There is or adnexia. So there is no anything like right ovary. It is normal, and left ovary is also normal. Okay. So this is the case. Now I want to focus over the case. So it is the first, the patient, as I told you, that in the September, I got it examined for USG. So this case came to be on 9th September 2018. And the girl was 22 years old and she had periods delayed, 10 days of course delayed. Mens was a jelly-like clots, and there was no menstrual bleeding as such, but a strong fall smelling, dark brownish, for 3 days spotting before period and after period, pain during menses 2 days before the commencement of the period for 3-4 days. And this trouble was for 10 years. It means I did not ask whether it started from the menarche or not, since the patient was saying that 22 years, she might have hidden the age exact. So it was said that 10 years, for 10 years it was happening. So apart from that, there were some other symptoms also, like itching in the nostril and anus for 6 months, regurgitation of food, heartburn and dyspepsia, pain in epigastric region for 5 years. Okay, and apart from that, there was itching of skin, appetite diminished, desire sweet, strong desire for sweet, desire for warm food, and she was thirstless. Her stool was very much noisy expulsion, gas, and sore smelling. Urine, she has frequent urging for urination, and urine was also interrupted flow. So, and sleep was very much disturbed, catnap sleep, and she was feeling choking like during sleep. Gets a bit up for 7-8 years. So there are not only single trouble that she was suffering from only PCOD, but there were some other trouble also which she was experiencing, and that is why I am showing you that is this is the case. And so dreams of daily event, company desire for, and fear, alone being, emotional, weeping. She had depression also, and in the life she has suicidal tendency also, irritability. When someone tells a lie, she get anger, and anger was violent, and no enthusiasm in her life. There was sadness, and thermally she was hot. On the basis of this symptom, there were number of symptoms. So it was not decided that it is I should give one medicine or that medicine. So what I decided in this case, seeing the symptoms, that it is the soric and psychotic case. So being a psychotic case, I wanted to plan that first to give the anti-soric treatment and then antipsychotic treatment. So on the basis of this, I decided, saying all those several types of symptoms, several types of emotions, several types of period disturbances, several type of suicidal thought, emotional, and dreams and sleep. So I decided to give first antisoric medicine. So in the first prescription, uh, sulfur 200, two doses was given. One dose was given in the clinic, and second dose was told to take it early morning, empty stomach on the next day. And this was uh, followed by placebo for 15 days. In the first follow-up, when she came on 24th 9 2080, feels overall slight better, itching of the nose better, but itching of anus is more. Her last period was on 18th 9 2018. She had dry clotted on the first day. Second day mucus clotted. Just a moment. Something. What is this? I am not. I'm unable to remove this. Yes, it came. I don't know what is coming on the screen. Another thing.
First follow.
Oh, yes, first follow-up. Yes, I was going on. So in the first of follow-up, these were the symptoms. And in the follow-up, no medicine was given. It was given placebo for 2 doses, and it was followed by placebo for 15 days. In the next 27, she came on and on 27th, she reported that on 22nd, her period started and there was a lot of cramp and had carrying like a smell in her period. And this time, I gave Calcarea Carb 202 doses. Our My father was also a doctor, homeopath doctor. My elder brother was also a homeopath doctor. So I had been given such thing, and even in the books it is written that SCL means sulfur is to be followed by calcarea carb, then lycopodium. So on that thought, I planned that this lady, this patient was to be given sulfur, calcarea carb, lycopodium. So on that planning, she was given calcarea carb this time. And on 10th 11 2018, she was feeling feverish, etc. And itching of anus and nostril was better. And this time I gave lycopodium as 3 antisoric, sulfur, calcarea carb, and lycopodium. And after giving this is the now it is the time November 2018. Thereafter, on 26/11, she reported that she put some pressure to evacuate. There was some other problem also. So on 24th, 10th, the period appeared, and this time I gave her Netramur. And after Netramur, uh, The Thuza followed after Netramule. Thuza was given. And since she was having some mood swing also, so CPI 0Y1 was given at that time. And after CPI, this is the 5th of January. And I told you that in January, what I found that her polycystic ovary disease was recovered. So in this, I gave on the 5th January, Lycopodium followed by CPI 0Y2. Now, this is the 21st 1/2/19. USG dated 19 January 2000 suggests both ovary clear, no PCOD. Rest other ailments except pigmentation around eyes. Sign of hirsutism was observed on hair on upper lip. So this time placebo was given as a single dose and CPR 0/2 was given. What is the conclusion in this case? Because this case recovered within 3 or 4 months, the polycystic ovary disease was recovered. And it was recovered due to plan of the treatment. As I planned that there were several symptoms. So it should be given sorics and psychotic treatment. So first started with the soric, that is sulfur calcarea carb lycopodium, then followed by netramune puja. And the meanwhile, whatever symptoms were observed on the basis of those symptoms, CPI 0/1 and 0/2 was given. So it was a mixed chronic miasmatic case, and hence the treatment started with antisoric, then antipsychotic. The treatment continued further also for some other complications. Her basic concern was PCOD and it was recovered. So this was the case of Miss Asha, which was recovered. Now the cases which is in my memory. What I wanted to focus were here that when I started my clinical practice 30 years back, then a lady came married before 5 years, and she was having some problem in menstrual disturbance and having pain in her abdominal inguinal region. So this was the case. So at that time, whatever I had learned, whatever I had in mind, on the basis of best of knowledge, she was being treated. I started the treatment of that lady with my best of knowledge at that time. But after treating for her for 5 months, there was no improvement at all. In one of the follow-up, she revealed that the pain in the right inguinal region, and it was pinching like pain, as if some ants were biting her. On this, I prescribed her AP's Mill 30 thrice daily. At that time, I was not knowing that, and at that time I was not having computer also, so I was not well acquainted with the repertory. As I shown you right now, then in the right ovary, if there is cyst, it is APs. So since the APs was matching all the symptoms, so I gave her APs Bell 30 thrice daily, and after a month there was no pain, and in the following months, USG shown revealed that there was a normal scan. And then she conceived also, and babies also. Now the babies are grown up. So this was a case of a lady which was in my memory. Now a case of Svikirti. Svikirti was also suffering from polycystic ovary disease, but she was having several types of feeling. Like during vomiting, she was having vertigo, but she was very much fearful in dark. She had fear of ghosts. She was having a very friendly relation with anyone. She within 10 minutes she was very friend to mine, and she was of 15 or 16 years of age of that girl, and she had several symptoms which I have written down because at that time I was not using computer. So while this thing, I repertorize it, and in repertory it was indicated that phosphorus is to be given, and that PPT was given phosphorus, and that was my surprise that even within a month, I don't know when her abdominal pain reduced. After 1 or 2 months, she get it USC done, and it was revealed that there was no polycystic ovary disease. But I did not believe that how it can be possible that phosphorus can remove, but on the basis of totality, on the basis of homeopathic principle, on the basis of everything I gave phosphorus. So whatever medicine was indicated, it was given to her, and it vanished the the polycystic ovary disease. And when I requested her mother that please get it done from somewhere else also, so within 15 days, another ultrasound was also taken, and that was also that also revealed that there was no any cyst in the ovary. So this was a very good example of PCOD cases. One more case I do remember, that there was a lady of 35 years old. She came to me with several complications, and I do remember that she came in a camp when I had organized a camp, a health checkup camp. In that she came, and that case was taken by our revered sir, Dr. M.K. Sani, and that case was, and she was suffering several trouble, like she was having chronic renal failure with a cystic ovary, right side perhaps, if I do remember correctly. And her left ovary was taken out by the gynecologist as there was a cyst. So she was operated for that. She was having no issue. There was no conceivement at all. And her ovary was also uh, taken out, amputated. So next time when she got that she was having another ovary affected with the cyst, then she wanted to consult homeopathy, and that time it was given a dose of magnesium mule on the basis of totality. And to my utter surprise again, that the cysts were vanished within a 2-3 months. And what is I am focusing, there was a several other trouble also which was treated by me later on. But what I wanted to focus over, when I represented these things to allopath physicians, that such things happened and she recovered with this cystic ovary, then they told me, they argued me that it happens that it goes itself. And I said that when you knew it very well that it goes itself, then why the left ovary was imputed? It should have also not been taken out. Then they could not answer anything. So I am not giving any remarks to anyone, but this is what happening, that homeopathic can remove and cure any type of cases. Only one thing we need to understand, that we should focus over totality of symptoms, and on the basis of totality of symptoms, we should give the medicine. I should not focus that this is the disease and exact. We should not focus over the name of the disease, but we should understand the severity of the disease. We should understand other things also, that what is the condition of the patient. Or after seeing all these things, we should treat with, after individualization, on the basis of totality of symptoms, and that will be a true treatment through the homeopathic system of medicine, and it will be recovered. So, in lastly, I would want to conclude my lecture on the thing that any homeopath physicians whosoever are treating the diseases, they should not get disturbed with the name of the disease, that, oh, this is the cancer, oh, this is psoriasis, it cannot be cured. No, it is not like that. We should not focus over that condition. We should focus our principles and homeopathic plan of treatment. That will be sufficient. So, mind it, on the basis of totality of symptoms, we can treat any types of disease, and even we can cure the disease. I'm not saying that all types of disease. I'm not saying, remarking that all the advanced condition of pathology. No, I'm saying but just only those diseases which are natural disorders, chronic disorders, reversible disorders. Such diseases can be easily treated and recovered easily. So this was my lecture. Now, if anybody has any question, any queries, they can ask to me.
Yes,
I would like to stop the screen share.
sir, I have stopped, sir.
Oh,
Okay, sir. Uh, uh, Professor UK, Upendra Verma, sir, it's really a very good session from you because the piece you really impressed with the reasons of causes of this PCOD, and of course shared 3 to 4 cases, beautiful cases, and we all know that nowadays the new generation women, particularly youth, are not bothered about the lifestyle. They are just waking up by about 10 a.m. Or 12, 11 a.m. and then skipping the breakfast and taking the lunch by noon and by about some 2 p.m. or 3 p.m. And they take the supper by about 10 or 11 p.m. And that to a heavy one. And of course, with more chicken or beef or whatever may be, most probably chicken fry, and sometimes it may be smoked chicken or whatever may be, but they are taking heavy food and they are not doing not they are not at all bothered about the exercises. So these are the things that may be a precipitating cause for this PCOD, as well as the number of issues that happen in the home. Nobody, the parents are not able to give proper attention to their children, and they are always busy. They, whenever they want to talk to the parents, they just skip and they may, oh, I am busy with my work. I have to go office, or I have to. You just go there and you just study there. You just take a food like that. They are not at all caring. And they
yes,
are not, that means there is a breakup with the love in the love at home. That's why we failure at home, we can say, and not only the love failure with the person at that age, but it is the love failure at home also is a precipitating cause for this uh, these things. And what's your opinion on all these things? This is what I would like to ask to you also, because
yes, yes. You are Dr. Dhanesh. You are very much correct regarding these food habits and the lifestyle. That is what I focused in the earlier. So it is due to it is just out that why we are getting so many cases of young girls of PCOD. So perhaps these are the conditions, these are the lifestyle. That is why it is happening. They are unable to explain their emotions to their parents, and parents are on the contrast. They are also having no time, nothing. So they are unable to understand their children problem. So not understanding their problem, not communicating with the children, and children are not free to express their emotions to their parents. These are conditions definitely going to harm, and some hormonal disturbance. It may lead to hypothyroidism, it may to lead to PCOD, or whatsoever the disease name you can give. So there are several things. So what we homeopath think, that there are something which affect us, which is not being expressed. So it is expressed by the internal economy in the name of the disease. That is what is happening inside.
Exactly. The most important point as far as a homeopathic doctor is concerned, you just concentrate on the case itself rather than the disease, name of the disease. That's what our Professor Vendra Masa was telling, and this is absolutely 100%. You are right, sir. And
Yes.
I still remember a case of a PCOD case, a case of infertility that came to me some 30 years back. In those days, very people will go for these investigations, use this ultrasound sonography and all those things. But the case was like this. This lady has they were living together for 4 years, and there was no child. There was no fertility happens, and they consulted the gynecologist, and they started treatment for about some 1.5 years or so. And then one of their friend told them to visit me. And then when she visited me, what I got was that her menses is not regular, and after giving some medicine, the menses become irregular. But there was a problem in between that every 15 days after menstruation, 10 to 15 days after menstruation, she gets edema on the right leg and not on the leg side. And that this happens every alternate month. So with that, I got a thing prescription, just like as you rightly pointed out here, EPIS. Edema, what because I know what I noted here was that the on the usually it is the ovulation time, and during the edema happens on the right side, so it may be a problem with the right ovary. That was the in those days I couldn't differentiate this, or I couldn't understood this also, but only after the success I understood that it was a case of PCOD. And after giving this EPIS, everything stopped. And from the very next month itself, she uh, got pregnant. That,
Yes, yes, very good, very wonderful case, sir. And even without knowing that whether the patient was suffering from PCOD, PCOD or not, but on the basis of symptoms you treated, and her all the problem get recovered, and the priority was that she was not getting pregnant and there was no pregnancy, and it was due to your treatment that she got pregnant, and it all.
ah,
And thank you very much, sir, so for treating so well. So
yes,
I wanted to communicate one thing, that every physicians of homeopaths should do in the same manner, so that patients should not get cheated, that they are being cheated with some homeopaths who are not treating on the basis of totality of symptom, but they are just giving the patent medicines and just wanted to make the money. So that is not our aim and object. If we want to protect homeopathy, we should stick to the principle of homeopathy. Only then we can survive and our pathy will be highlighted in the medical world.
in most of the cases when we are when we undertook a USG for children, particularly at the age of 9 or 10, afterwards, sometimes you can see PCOD in them.
Oh,
Uh,
even 8 or 9 year, you are finding the
yes,
PCOD. Yeah,
yes.
I didn't know that, but actually, whenever a patient comes in the reproductive age, that is the menses when get disturbed, then only I think that there may be trouble of PCOD or PCOS.
Yes, yes. When we go into the depth of the case, we can find that there is some problem in the house itself. Uh,
Oh,
you
yes,
can
yes.
see there may be a quarrel between the parents. Usually, sometimes the husband used to, the father used to scold the mother in front of this child every time, and she may be seeing the mother is weeping or suppressing her fear. Sometimes the reverse may happen also. The father may be getting insult from the woman always, whatever may be the reason. But the child is there in between, and she may be suffering all these things, and the suppression of these things may develop this kind of PCOD also. Actually, the hormonal changes can happen when your mind is not in an order. Um,
Yes,
so,
sure. That is the main thing. Happens that whenever our mind is not in a position to work, if our mind is not working in a harmony manner, then all disharmony take place. And if this disharmony take place, so all the internal economical system, internal economy, what Dr. Kent has suggested, that get disturbed. And after disturbance, there may be the several types of diseases, and that several types of diseases are planned according to his or her corporeal constitution along with their parental constitution.
so, what kind of success rate you're having in your clinic, hospital? In-
Oh, I would like to tell right now about my clinic, that success rate of what? PCOD or some all types of
Yes,
disease?
yes, this kind of PCOD and all those things.
PCOD, it is almost, I'll say that 60 to 70% cases recovered, but there is still 30 to 40 cases are such that on that I am unable to cure that, and it might be perhaps due to
Whether you whether you
some.
take some specific exercises for that. Usually, I just ask them to do the preliminary exercise when those exercises being taught at the school. Uh,
Oh,
that is the best thing. Of course, 10 minutes, 2 to 3 minutes of jogging.
oh,
It's a very good and early. Ask the patient to wake up in the early morning so that your success rate can be much better, much more than that. Even with our homeopathy works even without the conditions, but of course, we can increase the success rate in much more level.
yes, I do agree with this, that if the diet and regimen is properly being taken under care, then there may be success rate definitely increase. But what I wanted to tell you right now, that sometimes it happens that the female who wanted to express something was not expressed at the time of clinical case taking, and that is perhaps due to one or two types of hindrance also in getting cured such cases. So it happens. It happens because
And And even after marriage, what I used to advise is whenever we take the case of what about the sexual habit, they so we have no time, so we have this intercourse only once in a week or twice in a week, or sometimes once in by week or for 3 to 4 times in a month. So what I used to suggest them that you should have at least 3 to 5 sexual intercourse every week. That will improve the your hormonal balance, and that will definitely give more success to the that not only success, you will get the result much
okay,
earlier.
okay, okay, but this will be restricted to the married lady only, not
Yes,
for the
yes,
girls.
yes, that's why I told in the early part that those married couple, I just mentioned.
Yes, yes,
Uh,
for married couples,
yes,
yes,
yes, yes, yes. That's what
yes,
I. Anyway, it's really a very good session, and
yes, yes.
yes, Ramprakash sir.
Ram
Oh,
Pravesh, Ram Pravesh.
Ramprakash sir.
Thank you, Dr. Banerjee. Congratulations, Dr. Verma sir.
Yes,
Very
sir.
nice very nice presentation. Excellent session. This presentation is a very beautiful presentation.
Okay, thank you, sir. If you
PC,
like,
PCOD and PCODS main cause. I am agree, Dr. Verma sir. Main cause of disease, family, past history, and present lifestyle. There are three engineers in the body: electrical engineer, electronic, electron disturbance, anger, fear, grief, and anxiety. And electron disturbance, then disturbance, chemical disturbance. It is harmonial disturbance. Harmonial
yes.
disturbance is called name of PCOD. PCOD, harmonial disturbance, then disturbance, mechanical disturbance, pathological disturbance is called name of PCOD. And
Oh, very good, sir. Nicely explained, sir.
main cause of disease, according to law of homeopathic science, miasmatic, sora, psychotic, and syphilitic. Sora is anxiety, fear, etc. So very, very thanks. Beautiful described PCOD. I am agree. Thank you,
Yes.
Barma Sahab. Thank you.
Thank you for your suggestion, your explanation related to electronic disturbance to hormonal disturbance then to lead to disease. Okay,
Yes, yes. Thank you. Very, very बढ़िया, बहुत अच्छा.
okay, sir. Okay, sir.
Thank you, sir.
Now I invite Dr. Lata Manoharan to say vote of thanks to this session. Yes.
Doctor, very good presentation from your side. Very thankful to you from myself and belong to IFPH and all presented in this section. I again very much thankful to you, to all of you present in the section. Thank you, sir.
Thank you, madam.
Thank you, doctor. Thank you.
Thank you.
Please wait one. Tomorrow we will have a session from Dr. Rajeshwari Rapta, and doctor will be discussing about first aid in homeopathy and scope of homeopathic medicine in emergency.
Oh, very good. Wonderful.
With that, we come to the end of the session. Thank you, Professor Upendra Verma, sir, and those who attended the session in this evening. And we are very lucky to have such a presentation, a beautiful presentation. And thank you all for the session. Thank you.
Thank you. Thank you, Dr. Ganesh. Thank you.
Definitely, you can watch the videos tomorrow itself.
Okay.
Please share with your students and friends also that
yes, definitely.
Homeopathy will be popular among all the.
Yes. Okay, sir.
Okay, good night. It's over to Dr. Rajeshwari to moderate the Malayalam session.